Nursing Assistant Army Exam 2026. Question 1. To prevent aspiration during feeding, the nurse aide should: Option A. Feed the client lying down. Option B. Feed the client with their head tilted back. Option C. Feed the client in an upright position. Option D. Feed the client only pureed food. The correct answer is option C. Feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 2. Normal oral temperature range is: Option A, 96.0 to 97.5 degrees Fahrenheit. Option B, 97.6 to 99.6 degrees Fahrenheit. Option C, 98.6 to 100.6 degrees Fahrenheit. Option D, 99.6 to 101.6 degrees Fahrenheit. The correct answer is option B, 97.6 to 99.6 degrees Fahrenheit. Normal oral temperature ranges from 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit, average 98.6 degrees Fahrenheit. 96.0 to 97.5 degrees Fahrenheit is below normal, hypothermia. 98.6 to 100.6 degrees Fahrenheit includes normal and low-grade fever. 99.6 to 101.6 degrees Fahrenheit indicates fever requiring reporting. Question 3. If the nurse aide observes a change in a client's condition, the aide should: Option A, document it in the chart. Option B, report it to the nurse immediately. Option C, wait to see if it gets better. Option D, ask the client's family what to do. The correct answer is option B, report it to the nurse immediately. Changes in a client's condition must be reported to the nurse immediately for assessment and intervention. Documentation can follow, but reporting is the priority. Waiting could allow a serious condition to worsen. Question 4. What factor is not known to affect vital signs? Option A, pain. Option B, age. Option C, hair color. Option D, exercise. The correct answer is option C, hair color. Pain, age, and exercise all affect vital signs. Pain and exercise increase heart rate, respiratory rate, and blood pressure. Age affects normal ranges. Hair color has no physiological effect on vital signs. Question 5. A client with dementia has difficulty eating. The nurse aide should: Option A, feed the client quickly to ensure adequate nutrition. Option B, allow plenty of time and provide cues to eat. Option C, puree all food to make it easier. Option D, skip meals when the client is resistant. The correct answer is option B, allow plenty of time and provide cues to eat. Clients with dementia need extra time and cues to eat. Example, pick up your spoon. Rushing can cause choking. Pureeing may be appropriate for some but not all. Skipping meals is neglect. Question 6. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A, rubber sheet. Option B, air mattress. Option C, emesis basin. Option D, restraint. The correct answer is option B, air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 7. What should the nurse aide do if a client begins to choke during a meal? Option A, call for help. Option B, perform the Heimlich maneuver. Option C, pat the client on the back. Option D, give the client water. The correct answer is option B, perform the Heimlich maneuver. If a client is actively choking, unable to speak, cough, or breathe, perform the Heimlich maneuver immediately. Calling for help can be done simultaneously. Patting the back is not the recommended primary intervention. Giving water can worsen obstruction. Question 8. A client with dementia has incontinence. The nurse aide should: Option A, place the client in adult briefs without offering toileting. Option B, offer toileting at regular intervals. Option C, restrict fluids to reduce incontinence. Option D, ignore the issue. The correct answer is option B, offer toileting at regular intervals. Regular toileting maintains dignity and may prevent incontinence. Restricting fluids can cause dehydration. Ignoring the issue is neglect. Briefs may be necessary but should not replace toileting. Question 9. The nurse aide's responsibility with advance directives includes: Option A, helping the client complete advance directives. Option B, honoring the client's wishes and informing the nurse. Option C, making decisions for the client. Option D, explaining advance directives to the family. The correct answer is option B, honoring the client's wishes and informing the nurse. The nurse aide must respect and follow advance directives and inform the nurse of any issues. The aide does not assist in completing advance directives, make decisions for the client, or explain legal documents to the family. Question 10. A client is withdrawn and refuses to participate in activities. The nurse aide should: Option A, force the client to participate. Option B, allow the client to choose and respect their decision. Option C, leave the client alone. Option D, tell the client they must participate. The correct answer is option B, allow the client to choose and respect their decision. Respecting the client's autonomy is essential. Forcing participation can increase withdrawal and anxiety. Leaving them alone may increase isolation. Offering options and allowing choice is the most therapeutic approach. Question 11. What should the nurse aide do first for a client who has fallen? Option A, move the client to their bed. Option B, assess for injury and call for help. Option C, document the fall. Option D, call the client's family. The correct answer is option B, assess for injury and call for help. Assess for injury while calling for help. Moving without assessing could worsen injuries. Documentation and family notification are secondary. Question 12. When should the nurse aide count an apical pulse for a full minute? Option A, always. Option B, only if the client is pediatric. Option C, when the pulse is irregular. Option D, when the client is sleeping. The correct answer is option C, when the pulse is irregular. An apical pulse should be counted for a full minute when the radial pulse is irregular to accurately count all heartbeats. Otherwise, counting for 30 seconds and multiplying by 2 is acceptable. Question 13. What is the correct procedure for taking an oral temperature? Option A, place thermometer under the tongue, close mouth. Option B, place thermometer under the tongue, breathe through mouth. Option C, place thermometer between the teeth. Option D, place thermometer on the tongue. The correct answer is option A, place thermometer under the tongue, close mouth. The thermometer must be placed in the sublingual pocket with the mouth closed. Breathing through the mouth or placing on the tongue leads to inaccurate readings. Placement between teeth risks breaking the thermometer. Question 14. The nurse aide should report which change in a client's vital signs? Option A, pulse increasing from 72 to 76. Option B, blood pressure increasing from 118/76 to 126/82. Option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. Option D, respirations decreasing from 16 to 14. The correct answer is option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. A temperature increase to 101.4 degrees Fahrenheit indicates fever and requires reporting. Minor variations in pulse, 72 to 76, blood pressure, 118/76 to 126/82, and respirations, 16 to 14, are within normal ranges and may not require immediate reporting unless accompanied by symptoms. Question 15. How should the nurse aide shave a client who takes blood thinners? Option A, with a straight razor. Option B, with an electric razor. Option C, with a safety razor. Option D, the same as any other client. The correct answer is option B, with an electric razor. Clients on blood thinners are at increased bleeding risk. An electric razor is safest because it reduces the risk of skin cuts. Straight and safety razors can cause nicks that bleed excessively. Question 16. The nurse aide should report which finding as a possible sign of abuse? Option A, bruises at different stages of healing. Option B, bruises on the shins. Option C, a client who is hard of hearing. Option D, a client with memory loss. The correct answer is option A, bruises at different stages of healing. Bruises at different stages of healing, varying colors, are a classic sign of abuse. Bruises on shins are common from minor bumps. Hearing loss and memory loss are health conditions, not necessarily signs of abuse. Question 17. A client complains of chest pain. The nurse aide should: Option A, give the client an aspirin. Option B, have the client lie down and call the nurse. Option C, walk the client to the nurse's station. Option D, wait to see if it resolves. The correct answer is option B, have the client lie down and call the nurse. Chest pain requires immediate medical evaluation. Have the client lie down and call the nurse immediately. CNAs do not administer aspirin. Walking may worsen the condition. Waiting could be dangerous. Question 18. Which approach is best when caring for a client with Alzheimer's disease? Option A, use complex medical terminology. Option B, use short, simple sentences and give one instruction at a time. Option C, speak in a loud tone to get the client's attention. Option D, ask open-ended questions. The correct answer is option B. Use short, simple sentences and give one instruction at a time. Clients with Alzheimer's have difficulty processing complex information. Short, simple sentences with one instruction at a time are most effective. Complex terminology and open-ended questions overwhelm them. Loud tones are perceived as aggressive. Question 19. What is the most important action a nurse aide can take to prevent the spread of infection? Option A, wearing gloves at all times. Option B, performing hand hygiene. Option C, wearing a mask. Option D, isolating all clients. The correct answer is option B, performing hand hygiene. Hand hygiene is the single most effective measure to prevent healthcare-associated infections. Gloves, masks, and isolation are important but do not replace hand washing. Hand hygiene breaks the chain of infection at the most common transmission point. Question 20. A client with a catheter should have perineal care performed. Option A, daily during the bath. Option B, at least once a shift. Option C, only if soiled. Option D, twice per shift. The correct answer is option B, at least once a shift. Clients with indwelling catheters need perineal care at least once per shift to prevent catheter-associated urinary tract infections, CAUTI. Daily is insufficient. Infection can develop within hours. Question 21. The nurse aide should speak to a client who is hearing impaired by: Option A, speaking very loudly. Option B, speaking slowly and clearly while facing the client. Option C, writing everything down. Option D, asking a family member to translate. The correct answer is option B, speaking slowly and clearly while facing the client. Speaking slowly and clearly with normal volume and facing the client allows lip reading and visual cues. Shouting distorts sound and is uncomfortable. Writing everything down may not be practical. Question 22. Normal adult respiratory rate is: Option A, 8 to 12 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 16 to 24 breaths per minute. Option D, 20 to 28 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. Rates below 12 indicate bradypnea, above 20 indicate tachypnea. Both require reporting to the nurse. Question 23. When a client is being discharged, the nurse aide should: Option A, assist with packing and ensure the client has their belongings. Option B, tell the client to call if they need help. Option C, let the client pack alone. Option D. Rush the client to leave. The correct answer is option A. Assist with packing and ensure the client has their belongings. The nurse aide helps ensure the client has all their belongings and assists with packing as needed, promoting a smooth, dignified discharge. Rushing is disrespectful. Question 24. Restorative care focuses on Option A. Curing the disease. Option B. Maintaining and improving function. Option C. Providing end-of-life care. Option D. Replacing the client's abilities. The correct answer is option B. Maintaining and improving function. Restorative care aims to maintain and improve the client's functional abilities, promoting independence and quality of life. It is not focused on curing disease or replacing abilities. Question 25. When dressing a client with a weak right arm, the nurse aide should Option A. Dress the right arm first. Option B. Dress the left arm first. Option C. Dress both arms simultaneously. Option D. Dress the stronger arm first. The correct answer is option B. Dress the left arm first. Dress the stronger arm, left, first, then the weaker arm, right. This minimizes discomfort and strain on the weak arm. Dressing the weak arm first would require moving it more.